deaths due to coronavirus in Victoria, an increase of 6. One death has been removed due to duplication. Those fatalities are 1 male in their 70s, 1 female and 1 male in their 80s, 3 males and 1 female in their 90s. We send our condolences and best wishes to each and every one of those families. All of those fatalities are linked to aged care outbreaks. There are 122 Victorians in hospital. 12 of those are in intensive care and 7 of those 12 are on a ventilator, so those numbers continue to fall, and that is great news. A total of 2,497,710 test results have been received since the beginning of the pandemic, which is an increase of 8,937 since yesterday. We're very grateful to each and every one of those people for coming forward and getting tested. These are essentially Saturday's numbers. Not great weather, obviously. These numbers are down a bit on each weekend anyway. But look, we would always want more and more people, the highest percentage possible of symptomatic Victorians to come forward and get tested. And what we don't want is a situation where test numbers are not an accurate measure of, not enough tests being done for us to have confidence that we've got a really clear picture of how much virus is out there. We don't want any steps in this safe and steady roadmap to be deferred or to be in any way compromised. So it really is important that each and every Victorian comes forward, gets tested. We still have confidence in that number, and the trend, as you saw, numbers steadily increased throughout last week, as they do each week. But again, it's a powerful reminder and my personal request and a request on behalf of all Victorians to get to the other side of this. If you've got symptoms, however mild, please come forward as soon as you register those symptoms. That can be when you are most infectious. Don't put it off for a day or two. You'll get your results within 1 day. That's 90+% of results now back within 24 hours. And it means that we can care for you, and we can also make sure that in your choices and in the 14 days afterwards, you're not putting anybody else at risk, and that we're managing this as best we possibly can. There are 4,291 cases of unknown source, an increase of 6 since yesterday's report. There are 176 healthcare workers who are active cases. We send our best wishes to them. We thank them and, of course, all of their colleagues, those who are unwell, those who have been furloughed, and those who are working so hard in every setting, every hour of every shift. They are true heroes, and we are genuinely grateful to them. There are 1,075 active cases in Victoria. In terms of active cases in the regions, we're now down to 47 active cases in regional local government areas that are under the Stage 3 restrictions. There are no new cases in regional Victoria today. Colac has 23 active cases, Greater Geelong 6 active cases, Greater Bendigo 1 active case, and Ballarat no active cases. So that is a testament to the hard work and the absolute determination of regional Victorians to not only get these numbers low, but to keep them low. And we're very grateful to every single person across regional Victoria for the part they are playing. Of course, regional Victoria took a step yesterday, as did metropolitan Melbourne. There's an opportunity for regional Victoria to take yet another step in just a few days' time if these trends continue. The Metro 14-day rolling average to 11 September is 54.4 cases. In regional Victoria, it has for the first time dipped below 4. It is now 3.9. That is a fantastic outcome. That's proof positive that this is not a theoretical exercise. It's a strategy that is working. And to see regional Victoria down to 3.9 cases, that means they are on the cusp of taking that next step. All things being equal, there's just a couple more days we need to get through, but we are very pleased to think that we'll be able to essentially take those big steps, but safe steps, towards opening regional Victoria up. Can I again just remind regional Victorians, the rules have changed. That's a good thing. That's a reflection of low numbers, but the rules still need to be followed. We'll have much more to say in coming days about individual plans for every single workplace. The Victoria Police efforts to make sure that the border between Melbourne and regional Victoria is as hard as it can possibly be, and also some other messaging around testing and some of the maintenance work that will need to be done to keep an accurate picture, particularly as regional Victoria opens up, to deal with the inevitable cases, the inevitable outbreaks that will be a feature of many months to come. But having got the numbers low, then we are absolutely confident that we can keep the numbers low. That's where regional Victoria is at, and that is the trend in metropolitan Melbourne as well. Can I just make a couple of comments in relation to these last five weeks or so? We've gone from 725 cases to now we're down into the 30s. That is a mighty effort, and it's something that every Victorian, regardless of whether you're in the regions or in the suburbs or in the centre of Melbourne, everyone's playing their part. Everyone can be proud and pleased to see that the trend is with us. The numbers continue to come down. Particularly if you just spare a moment to think about what's happening in other parts of the world where the trend is most definitely not with them. The trend is working against them, and the trend is making lockdowns for a second, third time in some respects much more likely. There matters for those countries, for those parts of the world, but France with 10,000 cases in a day, Israel just announced no more than 500 metres from your home, so they've had many thousands of cases in recent days. That's a 3-week lockdown. Spain, the United Kingdom, the list goes on, where there are many parts of the world that are coming into winter, which will be a unique challenge, as we have experienced. What's more, their case numbers are at such a high level that they're in exactly the place that we don't want to be in as part of a third wave. We simply must do everything we can to avoid that, and staying the course, doing this in safe and steady steps, is the only way to avoid thousands and thousands of cases. My last look at this earlier this morning, I think France has got more than 2,000 people in hospital, close to 500 people on a machine to help them breathe, and their R0 number is nudging up towards 2. That means every infected person's infecting nearly 2 other people. So it won't be 10,000 cases a day for very long. Of course, no one's pleased about that. It's just it is an opportunity to reflect on the fact that this can get away from you very quickly, and that if you were to open up at a level that was higher than the experts tell us is safe, then you won't be open for very long. You will have driven numbers down, but you'll have no chance of keeping them low. That's what this strategy is. Open up and stay open. Get the numbers low and keep them low. That's exactly where regional Victoria finds itself, and it's exactly the trajectory and the pathway, the roadmap that metropolitan Melbourne is on as well. And that should give people great optimism and a sense of real purpose to see this through, to defeat this, to see it off, so that when we do open up in those safe and steady steps, we can stay open. That's the mission. That's what we want to do, and that's exactly what we will achieve by everybody working together. In terms of aged care, we have 513 active cases. Disability facility settings, we have 10 active cases, 6 in staff, 4 in residents. And that's probably about it from me in relation to the usual updates that we provide each day.